Hi, everybody on Instagram and everybody on YouTube Live. Thanks for joining me today for this webinar. And it's called Integrating Advanced Wellness Strategies with Chiropractic Care. And it's something that I like to talk to my patients about in the clinic. I want them to be helping themselves in between sessions and long-term take responsibility for their health and to have better habits. Better posture, better eating habits, better sleep, nutrition, and exercise levels, all very important for lifestyle changes with chiropractic care. My name is Dr. Cary Yurkiw. I'm a chiropractor, and I'm here in Kelowna. I've been practicing now for 30 years. My first 15 years were in Winnipeg. The last 15 have been here in the Okanagan in British Columbia. And today what I want to teach you is some advanced wellness strategies that are going to help you that I've been teaching for many years to my patients. First, I want you to understand chiropractic care. So what is it? The basic of chiropractic care is, and it's all based on the principle that a bone out of alignment, particularly in the spine, interferes with nerve flow. So it can affect the nerve flow going from the brain to the body. And if that interference, that bone is put back into place, the nerve flow can get through and the body is stronger and healthier. So that's the definition of chiropractic, and the purpose is realignment to allow the body to work better, particularly through the nervous system. So there's many benefits to the adjustments. Not only do they make people feel better, but adjustments also enhance the function of your body, so you can do more. You can go for walks. You can travel. You can garden. You can golf, play tennis. You get the idea. You can do a number of things that you can't right now because your body's not working properly. That includes things like work too. So the role of chiropractic is very important in the wellness process because it allows the body to heal from the inside out, and it's something that's sustainable. Once your body starts healing and it starts to transform, starts to get stronger, then that's something that can be maintained or kept consistent over a long period of time. So I'm going to talk about how chiropractic care contributes to health and vitality today, but I'm also going to give you some tips. So sleep, that's one of the tips I like to give my patients, especially early on in care, because usually people are sleep deprived when they're in pain. They have headaches, neck pain, back pain, joint pain, and they're just not sleeping very well. So I give them certain tips, like how they should sleep. If you have pain on the right side of your body in your hip, generally I tell people to sleep on the left side. I tell people to get ready for bed by making the room dark, cooling the room down 1 or 2 degrees Celsius, turning off your phone or just listening to some music in a dark environment for about 30 to 60 minutes before you want to fall asleep. So getting rid of that blue light. And just kind of like allowing your eyes to rest. When there's no light shining on the retina, your body actually produces melatonin. That's going to help kick your brain into sleep mode. If you can't do that, sometimes I'll recommend patients get melatonin, talk to a pharmacist or doctor about that, and be able to supplement with something like melatonin. Sometimes I give my patients magnesium in the clinic. Magnesium is a very good way to relax muscles. It also gives your brain chemicals, good chemicals like L-theanine and GABA that are neurotransmitters to help the brain to relax. You want to establish a regular sleep routine. That can be accomplished for most people, but for some people, they just can't have a regular sleep routine because they work shift work. Like nurses that work 12-hour shifts, 4 days on, they have a day or 2 off. And then what happens is they go on to a different schedule. That can be hard on sleep routines. So trying to establish a regular sleep routine, very important. You want to go to bed at the same time every night. For me, I'm an early riser, so I go to bed around 9 or 10 at night, then getting up around 5 or 6 in the morning, and doing that on a regular basis, very important. And then good sleep is important for spinal health. It's important for health in general, but if you have the proper posture at night, you're sleeping on your back or your side, you have a firm mattress, you have some supports like pillows under your knees, it can help for you to get a really good rest. What are some latest chiropractic treatments that we do in the clinic? Well, some of the cutting edge treatments involve using instruments, doing drop techniques in the clinic. We use the Y-strap or the decompression tool to stretch the spine, all very important in conjunction with traditional chiropractic adjustments, which are like hands-on adjustments to correct the alignment of the body. We also use techniques like shockwave and laser. Shockwave and laser are acoustic or sound waves, laser being light waves that help the body to heal. So the light goes into the body, stimulates the mitochondria, and allows the body to heal quicker. Sound waves go into the body, do similar effects, break down calcium deposits, adhesions, bring in blood flow, allow that tissue to heal that surrounds the joint. And then we want to give our patients exercises to support spinal health. Some of the easiest ones that I give my patients are like the cat and dog stretch. So cat and dog, very easy on all fours, arching your back, looking up to the ceiling, then doing the reverse, arching your back the opposite direction, looking down to the ground, will really help you to stretch the spinal ligaments and discs on one side of the spine and then flipping to the other side of the spine. So cat and dog, very good way to start. Later I'll give my patients like wall angels to do for their posture, thread the needle for rotation of the body. These are all very good ways to help the body to for it to heal and for it to get the ranges of motion back. What else can you do? Well, you can plan to do better in between treatments in the clinic. So you want to create a synergistic approach with your chiropractor. So dietary changes, sleep enhancements, habit management, all very important. And one of the things I like to tell my patients is to get a journal so you can write in that journal. And so you want to record in your journal how you're feeling. You want to record any kind of changes to your environment, any changes to your habit, and then record the foods you ate, some of the exercise you did, what time you went to bed, what time you woke up. Just kind of get a routine established, and any changes to the routine, you can write them in your journal. And you can also write some notes on things you think you can improve on. So very good way to manage your plan at home going forward. Of course, you can show your health professional, you can show me your journal and say, what do you think? And I can always schedule something like a one-on-one health coaching session with you. If you're not in the clinic area, we can do a consultation with our consulting company called True North. So there's many ways that we can help you to accomplish your goals. We can also help you develop a personalized wellness plan. Some of those plans might include changing the foods you're eating, like macronutrients, eating more protein, healthy fats, cutting back on some carbohydrates and simple sugars, hydrating and drinking a lot of water, and adding some electrolytes to that. Very important for the hydration of the body. So those are ways that we support our patients in between visits on a visit-by-visit basis. We like to send them links and different videos that they can watch to help them to change their routines at home. If you're interested, I wrote a book, and this book is called Joint Journey, and it was published late last year. It promotes joint health, and it talks about a journey of two different individuals, a husband and wife team, that go to see the chiropractor. And when they see the chiropractor, they have a number of different health issues, but they have different health issues. The chiropractor assesses them, diagnoses their condition, starts treatment, and then introduces them to experts in different areas, like a dietitian, personal trainer, a psychologist, different people that can help them with making some lifestyle changes. The book is a good metaphor for what you can do to help yourself. So it is a book that I would recommend. You can go to Amazon, get the book Joint Journey, read that book. There's an audio version of it. There's also a hardcover version of it, and it's in Kindle as well. So you can sign up for Kindle. You can read the book in the Kindle program. Another book that I like to recommend is called Tiny Habits. It's by BJ Fogg. BJ Fogg is a professor at Stanford that taught the Instagram developers how to program their app so that people would use it and kind of come back to use it more and more. And in this book, Tiny Habits, he talks about how you can make small changes to your routine by anchoring the small changes to some major changes, major routines that you have in your life. So for example, if you want to start exercising, you can exercise just before you have breakfast or after breakfast as a reminder to do the exercise. So very important for you to start a new routine and anchor that to an existing routine so that you can accomplish that on a daily basis. Now, if you have any questions, I'll take those questions right now. I'll have a sip of my coffee as well, just so I can clear my throat. So if you have any questions, feel free to type them now in the chat. I'll be watching here in the chat on YouTube. If you are on Instagram, you can type the questions in the comments and I'll check on that as well. Sometimes people say things to me like, I don't have enough time to do exercises and stretches. I don't have enough time to make some lifestyle changes. This is very important. You have to prioritize some of the tasks in your life. And if that means you have to delegate some of those tasks to other people, that's something you should do. One of the things that I've been doing more recently is just ordering groceries online. It's actually a great way to be very selective about the groceries that you choose to eat. But also, it saves me a lot of time. It costs a few dollars, but people, they deliver it right to your door. You don't have to go out to the store. You don't have to park. You don't have to spend the money, driving there. So I found delivery with Costco, Walmart to be very effective in getting the groceries I need for myself and my family. So it's one of the small changes I made recently. It's been a healthy change because I can order fresh fruits, I can order meats, I can order different canned items that are healthy. I don't have to kind of go through the aisles and be more impulsive grabbing foods from the shelves. So it's a very good way to be very selective, and it can free up a lot of time for you to do things like exercise. So there's always ways to do it. If you really want to change your routines, there's ways that you can definitely get that done, and you don't have to kind of feel trapped like there's no way for you to change that routine, or it's not possible. Even if your starting point is really low, there's ways for you to kind of work with that, take some steps, and then start moving in the right direction. Over time, you can accomplish your goals. So I would stay encouraged. I just did a webinar just before this one. It was on weight loss, and I was sharing how I struggled to lose weight for years and kind of got discouraged, because of the failures losing weight. And then, I did research. I studied how the physiology of the body worked. I read some testimonials from people that applied some of those principles. I started doing that myself, and then I started to lose weight, and I just gained momentum. I started to see how much better I was feeling, how much better I could do exercise, and it really kind of accelerated the momentum that I had to lose weight. So I wouldn't give up if you're struggling. I would search for answers. I would ask other people that have knowledge in the area for answers. Talk to your health professional. You can talk to me in the clinic if you're a patient of mine. But just reach out and then try some new things. Even if you failed before, try some new things to try and improve. Okay, I'm going to go on to the next slide here. And what can you do? So in closing, I want to give you some calls to action here. So you can contact our clinic at tutstreetfamilychiropractic.com, and you can do that by phone, or you can message us, text message at 250-486-0062. You can also go to our website, tutstreetfamilychiropractic.com. You can book an appointment there. So that's one way you can get started with us. You can attend future webinars that I do on Eventbrite. So you can go back to Eventbrite, look at the free webinars that I have upcoming, and then sign up for the ones that you're interested in. We're usually 2 months ahead. So when we get to the end of July, we'll be releasing the September schedule. The August schedule is already out on Eventbrite, and it's on our website too. If you go to the event page on our website, you're going to see the upcoming webinars. You could also attend a masterclass, and we just added the masterclass for this Sunday. So if you want to know more on this topic, we're going to give you a chance to participate in a Zoom webinar where you can actually ask direct questions about your circumstance, and you can get answers. You know, there can be some interaction on the Zoom call. You'll get greater value out of that. We're going to get more in depth into this material so you can learn more. It's a longer duration as well. It should be around 45 minutes to an hour versus 20 to 30 minutes at the free webinar. You can also sign up for health coaching here at the clinic. You can also sign up for group coaching or one-on-one coaching at the consulting company that I have called True North, which is at trueexpert.pro, and I'll give you a chance to do that in a second. So you can go to our website, and our website is www.tutstreetfamilychiropractic.com. If you have any questions, you can email them to info@tutstreetfamilychiropractic.com. You can sign up on the website for our mailing list if you want to get regular email newsletters. I do blog on a regular basis, so if you go to the blog tab on the website, you're going to get the latest blog posts, and they usually revolve around the upcoming webinar. So I've been blogging about this topic for about a week and a half now, and you'll get different perspectives on this topic if you follow my blog. Recently, I actually just joined Substack too. I'm really enjoying writing on Substack. You can follow me there, but the easier way is just to go to our website and go to the blog tab. trueexpert.pro is the place where I do my coaching and consulting. The email address there is info@trueexpert.pro, and our phone number at True North is 778-215-9310. So I want to thank you for joining me here today. I hope you learned something about integrating wellness strategies into your lifestyle. If you are interested in the masterclass, learning more about this, I would encourage you to go get a ticket. There are some early bird tickets available. They're a lot cheaper than the regular tickets. Those tickets are available until 6 p.m. tomorrow. That's Friday. Then after that, you can buy the regular price tickets up until 6 p.m. on Saturday. The webinar will be on Sunday at 1 p.m.